My name is Pauline Irungu. I'm a director for policy and public affairs at Pfizer. Previously, when I started the WomenLift health journey, I was a global policy and advocacy advisor at PATH. So my project focused on elevating the voice of African women, civil society leaders in global health decision-making, specifically for maternal and newborn health. And my intent was to ensure that a vibrant voice of African women civil society leaders is driving equitable health decision-making. I thought about this project because of serving at the global level, observing the decision influencing and decision-making platforms, and realizing, one, how limited the voice of developing countries is, number two, how limited the voice of Africans is, and how limited the voice of African women is limited. So it's a most marginalized voice in many ways. You can see numbers, but to what extent are those numbers being able to shift decision-making? So to be able to move this project forward, I looked at how will I do it is through targeted support, building linkages with African women leaders, so that then I can introduce the concept and gauge their interest in participating in global level decision-making. And to be able to move them forward, how do I do this? Is working through a mentorship approach as an important strategy for equipping these leaders, both with skills, but also confidence to engage at the global level. It's one thing to engage at the local level. Global level just requires a different set of skills and sophistications. To be able to move this project forward, I layered it onto a project within PATH's advocacy program. And out of that program, then there is opportunity to engage in global level platforms. That project already was interacting with these tables and could be able to bring the voice of African women leaders so that they can contribute their experience, their expertise, and really position the interests of their communities. So I had a lot of conversations with diverse women civil society leaders. I established their interests and the need for mentorship, so I could know where the mentorship gaps, and those mentorship gaps helped me to develop a mentorship brief to guide conversations with the women leaders. I also did a bit of outreach to the global decision-making tables so that they could open up space. And finally, is being able to link at least 4 women leaders to connect with these decision-making tables or groups or committees so that they could contribute to making decisions for maternal, newborn, and child health. I know some people ask which are those. So for example, it's groups like PMNCH, Every Newborn Action Plan, as well as Ending Preventable Maternal Mortality, and Align MNH. So those are some of them. So throughout the WomenLift health journey, there's the leadership journey roadmap, and it's got 4 components. And this is how this project has been embodying the pillars of this leadership journey roadmap. So bringing authentic leadership. I'm very passionate advocate for maternal and newborn health, and my own experiences and those of communities that I've served have really shaped my passion and have shaped the way I want to show up as a leader. It's in terms of being driving inclusive leadership, is through opening doors for other women leaders to emerge through my knowledge sharing, as well as leveraging my networks to bring them forward and to enable them to flourish as leaders. The third pillar is the strategic leadership. I deployed a lot of pragmatism. There were many ways I could have addressed this project. I could have started with a lot of analysis, but I thought there are already existing opportunities. I can see the gaps. So it's to move forward and tap opportunities and position women leaders in these decision-making tables and let them bring their voice. And for me, the fourth one of impactful leadership is through that mentorship and growing others so that they can go ahead and broaden their horizons and build up their advocacy for maternal and newborn health advocacy. So to sustain my leadership growth, I want to continue to broaden my networks through outreach across different countries. This project gave me a lot of opportunity to engage with women that are outside of Kenya, that are not in developed countries, but within my own continent. I got an opportunity to mentor them, but also for them to share their experiences with me. So I also got return mentorship. It's engaging a range of global decision influencing platforms, being able to knock on the door and ask, can we bring one more person in, and getting that conversation going and being able to either succeed or have to wait. But also I did leverage a lot the power of my own story, especially through mentorship programs and telling other women, this is my journey, this is how it looks like, this is what to pay attention to. I built a lot of allies in the process across the continent, but also at a global level that are helping with my own growth. And finally, out of this leadership program, I'm quite excited to share this news that I've transitioned out of, when I started, I was at Path, but I now have a new career assignment, and that provides opportunity to really deploy my leadership skills, to learn and to grow in a whole different work environment, out of civil society, development, not-for-profit sector into private sector. And I want to take the lessons out of the WomenLift Health program with me forward. Thank you.